Hello there, you're watching Apollo 11. I'm Paras Tomar. It's called the pumping station of the human body. We're talking about roughly 1900 gallons or 70 to 100 liters of blood being pumped through its system every single day. Now, with a system like that, you really don't want anything to go wrong, do you? You might have guessed by now, today's episode is about cardiology. Dr. Naresh Trehan, one of India's and perhaps even one of the world's leading cardiovascular cum thoracic surgeons. You know, the number of patients who come and see him every day is phenomenal. Why is that exactly? Well, now is when we find out. I mean, Mr. Shah and his family have come all the way from West Bengal actually for a checkup. Now, this is his last checkup, and he had a surgery done in February this year. जब पहले आप आए थे, आपने डॉक्टर नरेश त्रेहान के बारे में क्या सुना था?
एंजियोग्राफी हमारा हुआ था वेलोर में हुआ था। वहाँ पकड़ा गया कि हमारा ब्लॉकेज है तीनों वॉल में, तो हम वहीं फाइनल कर लिया, डिसीजन ले लिया कि इंडिया का सबसे अच्छा डॉक्टर कौन है, उसी का हाथ में, सर्जन का हाथ में कराएंगे। तो वहाँ बहुत से आदमी से पूछे हैं, कुछ कार्डियोलॉजिस्ट से पूछे हैं, तो उसमें से निकल गया डॉक्टर नरेश त्रेहान।
He's a good doctor. He's popular. You see him on TV, on the news and all. He's done a lot of good for a lot of people. And
Explain to us, please, the number one in his field.
Yes, actually, I mean, he is. I would put him among the best.
Sure.
He's good. There's no doubt about it.
So great. So he came to the right doctor. He feels a lot better. Wish you a speedier recovery than you're already on.
Yeah, thanks so much.
Doctor, we've been hearing so much about you from your patients, and the fact that a lot of people have come here simply because they've heard so much about you. Is that also a lot of pressure at some level?
No, you know, it's one of those things when you commit yourself to being a doctor and then patients need you and they come to you, then it's basically a nice thing to happen. I mean, so it's not a pressure, it's in a way, it gives you great gratification that you can, people believe you, they trust you, and then you must do your bit to make them better.
As a doctor for you, what drives you and what challenges you enough?
See, the way you look at life as a doctor is like a person comes to you who's not well. That means he's seeking help. The second fact is that his defenses are down because he's the victim right now. So a doctor must have complete compassion for that person, because you never can get irritated with that patient because he's the one who's suffering, not you. And you can imagine the fears that goes through a human's mind when they're not well. So it's very important that you treat a patient as a complete human being who is actually maybe in certain terms being unreasonable, but that's not unreasonable because he's suffering. So that's one very major part of your relationship. Second is that you must also be very honest at that time, because integrity of medicine cannot be compromised, because you are actually being trusted by the person to do the best for him. That's why he's come to you. So you must do the right things at the right cost. So that's why I have very strong feelings about the integrity of medicine, the compassion for the person, and third, try to make it as affordable as possible, because for them to be able to save their lives, for them to be able to get the relief that they need from their disease, again, they should not have to sell home to be able to access healthcare. So these are the three tenets of being a doctor which I hold best to my closest to my heart.
What is your average day like? How busy are you?
I work regularly 12 hours a day, 9 to 9. So in the morning I do my bit, what I recommend, exercise and yoga. And then I'm back at work for 12 hours.
But it's not uncommon for you to do 5 or 6 in a day also surgeries.
Even more.
Even more sometimes.
Right.
Right. So I've been happy to sort of meet up with you. I'm waiting to see you in action outside the office and
Very
into what you do
welcome.
best.
Right, okay, sure.
There are words like echo or stress echo or ECG that are constantly being thrown at me. But what do these words really mean? Let's go find out. I'm with Dr. Vinayak Agarwal, who's a consultant cardiologist at the Appollo Hospital. You work with Dr. Trehan, right? I do. I'm actually hoping to understand a lot about the heart and the process involved. So when a patient comes in, what's step one and how does the process go through from there?
I think the commonest scenario which you come across is a patient who has complaints of chest pain or breathlessness. These patients, after taking a detailed history and physical examination being done, there are a few very basic tests which the patient can go through. They go through tests like electrocardiogram or ECG, which is very commonly in a layman language. ECG is nothing but a machine which picks up the electrical impulses from the heart and gives them a form of a graph. So it tells us about what the basic electrical activity in the heart is all about, and then it has various implications.
So we've seen the ECG, which is an elementary test. What are we doing now?
What we do is we do a very simple test called treadmill test. The treadmill test is nothing but connecting the ECG to a patient who's exercising and recording that ECG trace. We want to test that when we stress the heart, does the heart show signs of poor blood circulation or not? Now in stress echo, we do an echocardiogram, which is the ultrasound of the heart, before we start the treadmill test. And once the patient finishes the treadmill exercise, he comes back and rests quickly on the couch, and we do the echocardiography again at a much higher heart rate, which gives us a much more information than just treadmill test alone. So I'm going to do the echocardiogram now, which is an ultrasound of the heart. Now this is the screen on which we can actually see the heart in motion. And you can see immediately the heart in motion. Now this is the heart. This looks quite good.
So we've seen Dr. Vinayak do the first two parts. Let's complete the test and let's see how he fares on the treadmill. So that completes that test.
The contractility, you can see the contractility of the heart is quite good. There is no lag in the wall motion or the motion of the heart, which means that the patient has no heart disease.
I'm off to go and meet Dr. S.K. Gupta, who's a senior cardiologist at the Appollo Hospital. You know, if expert advice means anything, his is the one to take. Dr. Gupta? Hi, I'm Paras. When it comes to the matters of the heart, you need a specialist, and Dr. Gupta is exactly that. You've been here about 14 years now, right? I have a few questions if you had the time for it. Well, the first thing I really want to understand is, in your, the speciality, what is the basic condition that most people come to you for?
No, as you know, I'm a heart specialist, so people with heart disease come here.
Sure.
And majority of patients, there are so many heart diseases, majority of the patients who come to us are with coronary artery disease.
Dr. Gupta, what is coronary artery disease?
Coronary arteries are the arteries of the heart, and whenever there is a block in the coronary arteries, arteries of the heart, it leads to either angina or heart attack.
So the cases of this now are a lot more
There are
frequent.
lots of cases nowadays of coronary artery disease.
You know, we've always looked westward for really more treatments and stuff. Is it also like places like Apollo are really changing our idea of medical science in that sense?
See, there is no doubt about that. The infrastructure we are having today is one of the best infrastructure, and we match to any Western world hospitals. And then the skill of the operators is almost at the par of the Western people. So that's why, and we are much cheaper in comparison to the Western. See, normally we say that suppose a bypass surgery or angioplasty, we can do at 1/10 the price of the Western world.
Doctor, can you tell me a little bit about your patient?
Now this lady has come to us with difficulty in breathing. She came for investigations, and on investigations we found that her heart is quite weak. Her coronary arteries are normal. So we have decided to put a triple lead pacemaker, which can make her quality of life better.
A lot better. What is a pacemaker?
Pacemaker is a machine which gives current to the heart, and it stimulates the heart, different chambers of the heart. By putting this pacemaker, we make the different chambers of the heart work together so that the pumping function of the heart improves.
Okay, you decided to come to India and to Apollo because did you read up about it a lot, or was it recommended?
Yes, when my condition became very serious, somebody recommended that I go to see the doctor.
So did they find out what was wrong with you even back home, or?
Yes, a test was done after I had my baby, and they discovered that they were suspecting that I might have a blockage in the artery in my heart, but it wasn't properly diagnosed until I came to Apollo.
Do you have family also which has come with you to Delhi?
Yeah, no, I came with my sister and my child.
Okay.
Yes.
All right. Hopefully your surgery will go absolutely well and you'll have results which you're looking forward to. We will see you after your surgery very
Okay.
soon.
All right. Okay.
Dr. Naresh Rehan is already doing his first surgery, and remember this is one of his 6 through the day. Let's go see the bypass, let's go see how it happens, and more importantly, let's also go see the technology and how it's part of in everyday procedures.
All the arteries are blocked, right? So what we are doing is we are bypassing them individually, and we are doing it on a beating heart, which is the latest technique, so that the patient can recover much faster. Otherwise it takes about 6 to 8 weeks for the patient to recover. With this technique, 3 to 4 weeks he can be back to work and everything. So half the time.
I'm with Dr. Gupta, and he's doing an angioplasty and an angiography today. The first thing I really want to ask you is, what is the difference between the two?
Angiography is the test. We inject the dye into the coronary arteries or wherever we want to do angiography and take photographs. Angioplasty is a treatment in that we put the balloon inside and dilate the artery and then put the stent.
And it widens the artery. So doctor, once you've done this angioplasty here, how long is this going to be okay for completely?
Normally they do very well. What we have seen is that after angioplasty and stenting, 4-5% patients develop a reoccurrence within 6 months.
Okay.
But you can say 95% patients, they do very well. Maybe 5 years, 10 years, he may continue to be normal.
So the angioplasty itself is the physical change that you've made in the body to provide what it needs. What about like medical help in terms of medicines and drugs and anything?
No, you rightly said angioplasty is a treatment of the local disease, but to prevent disease further, we have to do the lifestyle management, we have to give medicines, we have to avoid stress and do regular exercise. Those things are inevitable, they have to be done.
Dr. Modi?
Hi.
I am Paras.
How are you?
Very good, thank you.
See you.
The first thing I really want to ask you is, you're a cardiologist.
Yep.
How is that? How different is it from a cardiac surgeon?
Oh, cardiac surgeon is for surgery,
Okay.
for the operative procedure,
Sure.
which
And
is
a
a surgical
cardiologist?
procedure. Cardiologist is for everything else, actually,
Okay.
for the heart diseases.
Okay.
You know, for managing medicines, for angiography, for angioplasty.
Okay.
And surgeon is for surgery.
You know, doctor, there's some words that we keep hearing about. Words like hypertension or heart attack or coronary artery disease. These might be words we were hearing, possibly know what these words mean. But clinically, outside the layman's perspective, what is the larger difference in the three?
See, high blood pressure disease is called hypertension. Heart attack is a completely different thing. You know, heart attack means a particular area of the heart gets attacked. Attacked means it doesn't get the blood supply and that area doesn't function suddenly. Coronary artery disease is a general word for disease of the coronary arteries. Any disease which blocks the arteries. So arteries of the heart, when they get disease, and usually most of the time this disease is a blockage disease. That is called coronary artery disease.
You know, in a matter of just speaking about a healthy heart, what are the kind of signs that people should really look out for when they know that they need to sort of come and see you because there's a problem there?
Usual symptoms what we look for in cardiac cases is shortness of breath, particularly during effort, particularly when you exercise or you do sort of any kind of effort, or chest heaviness, chest pain, chest discomfort, not feeling well in the area of the chest, many times unexplained nausea. You know, the headaches is one of the very common symptoms of hypertension. So, you know, these symptoms, breathlessness, chest pain, headaches, they should be noted.
You could have gone anywhere. Why did you choose to come to Appollo and practice here?
The advantage of Appollo, of course, it's a good infrastructure, but then another very good thing is that you get a lot of non-cardiac problem support. So I get a good nephrologist to take care of my patient, I get a good neurologist to take care of my patients with the brain problem. So, you know, the associated comorbid conditions are taken care in a
So
very,
that's trying to
very
say.
specialist way.
I'm with Dr. Gupta's associate, Dr. Sushila, and the patient seems to be doing extremely well. She's got the pacemaker in her. How's the recovery coming along?
From our side, she can be discharged actually.
Okay.
But being from the other country, she would like to stay in the hospital, get other investigations done. She will require her for suture removal next week.
Okay. So after a surgery, typically for most patients, how long does it take before they can actually go home?
We send them the next day itself. Most of the patients do well and we send them the next day itself.
Okay.
And we give them certain precautions to be taken.
So what are some of the precautions that the doctors have told you to sort of take over the next couple of days after your surgery?
First, I must watch my fluid intake, and then again my sodium intake, salt intake.
Okay.
Those are the very strict rules they've set for me now.
Okay.
And then I can't lift anything, and you know, everything I do now will just be I watch to make sure that I don't exert my energy watch my food intake just to make sure that I don't, take the things that are not good for me right now.
And what is going to be the immediate difference perhaps in the quality of her life after surgery? Now, what are the things that you possibly had difficulty doing earlier that you'll be good to go?
Like they said, almost everything. I can drive. Dancing, I love dancing. That I can do after, a few months, and every other thing follows. But make sure I don't answer my phone on the left-hand side. I cannot hold my cell phone on my left-hand side, that's it.
To keep it away from the heart?
Yes, just stay away from powerhouses.
So we wish you a speedy recovery.
Thank you.
You'll be absolutely healthy very soon.
Amen.
Good luck.
Thank you very much.
The road to recovery begins from you. You can have all the doctors in the world, you can have all the medicine, you can have all the technology, but if you are not willing to be alright, I honestly don't know what can help you. That's it on Apollo 11 from this week and from me, Paras Tomar. We will see you next time. Until then, just remember, let the doctor worry about the condition of your heart. All you need to worry about is that your heart is in the right place. We'll see you.
Last week's question was, which of the following can cause heart attack? A. High cholesterol and high BP. B. Smoking and diabetes. C. All of the above. Or D. None of the above. The right answer is C. All of the above. And the winner is Dr. Kavita Rao from Chennai. She wins a voucher for an Apollo health check. The question for this week is, which of the following conditions can lead to bone weakness? A. Postmenopausal women. B. Less calcium intake. C. Loss of physical activity. Or D. All of the above. Type Apollo 11, space A, B, C or D and SMS your answer to 56388 to win a free health checkup at your nearest Apollo hospital. For the right answer, tune into Apollo 11 at 9 AM this Thursday.